You are highly welcome in this page of fertility and family planning. In this episode, what we'll be discussing today is the causes of miscarriage. If you look around us today, you notice that many women are experiencing miscarriage. In fact, they're having the occurrence of miscarriage. But in this episode, we'll be discussing the causes or the reason why some women are having miscarriage. It's good thing to know that in this episode I'm not handling it alone. In fact, I have a potential nurse that will be assisting me in this episode, whose name is Shison. Shison, you're highly welcome to this episode.
Thank you.
Yeah, you're highly welcome. So I don't know if you've noticed, you will say that there's lots of women around the world are experiencing loss of their baby, loss of their unborn child.
Yeah, okay. When you talk about losing babies, unborn babies, or miscarriages, based on research, about 10 to 15% of women lose their baby yearly. Specifically, about 15.3% of pregnancies are being lost yearly. And out of this percentage, we have 80% of miscarriages occurring especially during the first trimester.
Wow, that's a whole lot of them.
The worst part of this is that about 70% of women who are affected, like women who experiences this miscarriage, do not know the reason why they lose their baby. As a matter of fact, about 60% of these 70% of women who experiences miscarriages don't even care to know the reason why they lose their baby, which is very bad.
Though it do pain some people because for losing their pregnancy, and this has caused many people to experience trauma as a result of the shock of losing their unborn baby.
Yeah, that's true.
Let's break this thing down. The whole thing about miscarriage. Now when we're talking about miscarriage is just like we can as well call it spontaneous abortion. And miscarriage is losing one's pregnancy within 20 weeks of gestation. So if someone loses her pregnancy within 20 weeks, that is what miscarriage is. And just like I said before, it really causes a lot of, it often comes with pains and also with trauma for some women.
And then there are several causes of miscarriage, which include, we have endocrine dysfunction. When we talk about the endocrine system, we talk about hormonal imbalance. But now in this case, I will not call it hormonal imbalance. I can call it hormonal insufficiency. In this case, during pregnancy, a hormone known as progesterone is being released in order to support and maintain the viability of the pregnancy. But in a case where the woman is secreting or producing just little amount of progesterone, that pregnancy is at stake, which should therefore lead to miscarriage. Another one is fibroid, which is known as the uterine fibroid that occurs in the womb or the uterus. Okay, this fibroid, this growth obstructs the space where the fetus or the baby would normally occupy and grow. So as a result of this, it is now like the fibroid and the baby, they are doing competition who would survive within that little space. And at the end of the day, miscarriage happens.
Yeah, another causes of miscarriage which I also notice is alcohol. I noticed that if a woman is taking lots of alcohol during her pregnancy, it can as well lead to miscarriage. So that's the reason why I'm saying it is advised for those women who are pregnant to avoid too much intake of alcohol. Now, apart from this, another thing that can as well lead to miscarriage is incompetent placenta. Now, this is a situation whereby the placenta is not supplying enough oxygen because of the malfunction of that placenta, or maybe the placenta is not enough to supply the enough nutrients or oxygen to the unborn baby, to the fetus. So in such a situation, it will affect the growth of the fetus and the development of the fetus. For that reason, in some cases, this can as well lead to miscarriage.
Also, infection also causes miscarriage, especially that of the uterus. which is known as endometritis. It causes miscarriage because the endometrium of the uterus is affected, and so this endometrial wall, which would normally serve as the as the medium for attachment of this of the placenta and then the fetus or the baby, is affected, leading to the endometrium of the uterus not being capable enough for this process of implantation and the rest of them, and so miscarriage would happen. Also, drugs too can cause miscarriage. So as a pregnant woman, it's advisable for a pregnant woman to take prescribed drugs. Most times drugs are contraindicated for this set of people due to their conditions. So if these drugs that is supposed to be, or that are supposed to be contraindicated for them, are taken by them,
chromosomal abnormality is one of the causes of miscarriage, which I've also noticed. If there is abnormality in the chromosomes, there will be a problem, and that problem, it may also cause miscarriage. Now, another cause of miscarriage, which many women often neglect, and this has posed many threats to women around the world, is stress. Stress is another cause of miscarriage. If a woman continuously stressing herself out during pregnancy, this can as well lead to miscarriage, especially in her first trimester. So with this, we can see that this is a whole lot of causes of miscarriage. If care is not taken, one may fall victim to any of these causes of miscarriage.
Yeah, actually, a whole lot of causes, and that's why women, especially pregnant women, should try as much as possible in order not to fall a victim of this situation.
You know, a woman once asked me this question: is it a must that someone must experience vaginal bleeding during miscarriage? The truth is yes. Most women experience vaginal bleeding during miscarriage. In fact, miscarriage goes along with vaginal bleeding. Vaginal bleeding is one of the most common symptoms or most common sign of miscarriage. You see vaginal bleeding, you see lower abdominal pains. This is most common symptom of miscarriage.
Okay, to add to what you just said about bleeding, bleeding per se does not only mean that miscarriage is happening. As a matter of fact, if a pregnant woman, whether she knows or she does not know that she's pregnant, experiences vaginal bleeding, especially during the early phase of pregnancy, usually the first 2 weeks when implantation is occurring, it does not really mean that she lost her baby. Sometimes it could be because of that implantation. Because during implantation they may be spotting.
Yeah, you're actually correct. I've never thought of this.
So in conclusion, the various causes of miscarriage include drug, stress, alcohol intake, endocrine dysfunction, that's what we talked about, hormone, chromosomal abnormalities, fibroid, incompetent placenta, and then infection.
That is it. And I know that all of you watching this episode must have learned a lot from what we just discussed now. You've seen these causes of miscarriage. If you have questions you want to ask, please, you can do well to drop it on the comment section. By the way, we so much appreciate you for watching this episode, and also appreciate Nurse Chisom for joining me in this episode. So much appreciate you. Thank you so much for. So thank you so much. So this is the end of our discussion today, and we are hoping to see you in our next episode.
Bye.
Bye.